I understand that the pain and discomforts of labor can get pretty unbearable, so if transferring to the hospital for some pain relief is what you need to do, then I fully support you. Just so that you're aware of all of your options when we get there, I'm just going to go through some of the most common uses for these medications. The first one would be topical pain relief, like lidocaine. Lidocaine can be used specifically on the perineum, in this case specifically on the perineum. Can also help relieve some pain from pushing, from that stretching and all of that. If you tear, some lidocaine might help with that pain relief from suturing, or if you need to have an episiotomy for whatever reason, that could also help with that pain relief as well. One of the most common forms of pain relief in the hospital is nitrous oxide, also known as laughing gas, and that's an inhalation. So this method allows for you to inhale a mixture of nitrous oxide and oxygen, and it can help relieve pain and anxiety. Nitrous oxide does not remove all pain, so I think it's really important to remember that it is not going to take it all away, but it can help with early and active labor. It's fast acting and it has minimal side effects, making it super popular choice. Another method of medication would be IV medication, like morphine or fentanyl. These can be administered for more intense pain, and these are typically administered through a catheter, like an IV catheter into your vein, and they provide a ton of relief, but they also do come with some side effects like nausea, drowsiness, dizziness, and they can also pass through the placenta, potentially affecting your baby. And although those risks are often considered low in the grand scheme of things, I think it's really important to know that that is a possibility. Regional anesthesia, such as epidurals, or most commonly epidurals. This is one of the most effective methods of pain relief, and I think the most well-known. Epidurals are inserted in a catheter in your spine, and they deliver a continuous dose of local anesthetic, and they're usually combined with another opioid. The technique blocks pain from the waist down, allowing you to be alert, but also not feeling the intensity of the contractions. They're super effective in managing pain, but they do have some side effects, like a drop in blood pressure, longer labor, and a higher likelihood of needing extra help in delivery. So sometimes forceps, sometimes a vacuum, sometimes it might lead to a C-section because you're unable to feel the sensation of pushing. With the epidural, in the event that you do need a C-section, spinal anesthesia can be administered through that, and that is a one-time dose into the spinal fluid, and this provides immediate pain relief for procedures like a C-section. And then one that we don't like to use very often, it's saved more for emergencies, is general anesthesia. This is not really used for pain management in labor unless there's an emergency situation. So if we get into the hospital and there seems to be something emergent going on with baby or with you, general anesthesia is typically what they will use. And since there are some risks with that, like respiratory complications and potential effects to your baby, it's really reserved for cases where pain management, like what we talked about before, just aren't going to cut it, and we need to perform a C-section immediately. Do you have any questions?